Hi, my name is Mike. One of the most commonly felt issues by those who struggle with addiction is high anxiety. At the Annex, virtually every client who comes in to speak with us about getting help have expressed overwhelming anxiety. But the effects of high anxiety are real, and in most cases become roadblocks to change, recovery, and hope. Symptoms of anxiety can include one or more of the following in varying degrees of intensity: excessive and persistent worry or fear, restlessness, feeling on edge, difficulty with concentration, irritability, muscle tension, fatigue, sleep disturbances, avoidance behaviors, and breathing difficulties. The problem with having anxiety is that it pushes us to get high. While this may work in the short term, the longer term result is a worsening of the anxiety. So this becomes a vicious circle. Addiction reinforces anxiety and vice versa. The more you use, the more intense the anxiety. The more anxiety, the more you use. We can also get triggered for anxiety. The most common triggers are stressful events, social situations, and trauma. For most of our clients, considering entering detox or a rehab program can trigger overwhelming stress and anxiety. Thus, people who are not housed due to addiction issues tend to stay in that situation. This is the trap. If you're identifying with this, there are healthier ways to address your anxiety. Talk to a therapist whom you trust. There are many therapies available to help you learn to lower your stress response, such as mindfulness, meditation, yoga, animal therapy, and CBT or cognitive behavior therapy, just to name a few. We strongly urge you find out what is available in your area. If you wish to make a change in your life, but feel overwhelmed by that thought, perhaps you would benefit from reaching out to a social agency, a person you trust, a therapist, or your clinic to discover what opportunities and help are available. There is a life for you beyond the trap of drug addiction and anxiety, and it is waiting for you. Thank you for listening.